Hi guys, welcome to our lecture series. Today we are going to talk about the anatomical snuff box. Right here, this is your anatomical snuff box. Is mainly seen when the thumb is extended and the hand is in the ulnar deviation, which is medial rotation. So in this position, you can actually appreciate the following. You can actually see a groove, a triangular groove right here. That is what you call anatomical snuff box. Right. So, what are the borders of the anatomical snuff box? So, since it is triangular like this, it is going to have a lateral border, and a medial border. Right. So, let's go. The medial border of the anatomical snuff box are taking the position of being in the anatomical position. This side is going to be your lateral. This side is going to be your medial. Right? Assuming that we are in the anatomical position, right? So the medial border is going to be made by the extensor pollicis longus tendon. You can actually see this one. So this is your extensor pollicis longus tendon right here. Your extensor pollicis longus tendon, that's the medial border. The lateral border is going to be formed by two tendons, right? So this one being your adductor pollicis longus, and this one being your extensor pollicis brevis. So the adductor pollicis longus and the extensor pollicis brevis forms your lateral border. Done with the borders. Let's go to the floor. What do you appreciate in the floor? Right. So remember, in the floor, we are going to have the lateral proximal and distal carpal bones. The most lateral, right? The most lateral proximal is going to be your scaphoid, right? And then the most lateral, this is going to be your scaphoid right here. And then the most lateral distal is going to be your trapezium. Remember, your trapezium is the one that will articulate with the first metacarpal bone, which is on the thumb, right? So the floor is going to be made one by the scaphoid bone, two by the metacarpal, by the trapezium, right? And the ending tendons of the extensor carpi radialis longus and extensor carpi radialis brevis forms the floor. Let's go to the contents of the anatomical snuff box. What is the contents of the anatomical snuff box? Right. So right here you can actually appreciate this is going to be your superficial branch of your radial nerve. This is your superficial branch of your radial nerve. It's going to be a content, right? You're going to also have your radial artery. This is your radial artery going to the dorsum of the feet, of the hand. It's going to be a content, as well as the scaphoid bone. The scaphoid bone is going to be a content, right? So superficially, you're going to have the cephalic vein also being a content of your anatomical snuff box. So let's go again. What are the contents? The cephalic vein, the superficial branch of the radial nerve, the radial artery, and the scaphoid bone. Right. What are the clinical importance of the anatomical snuff box? So the anatomical snuff box is an important clinical region. So when the hand is in the ulnar deviation, like I said, right, the scaphoid becomes palpable in the anatomical snuff box. So you can actually palpate the scaphoid bone, right? So this position it is also important to assess what's called the scaffold fracture, right? So the scaffold fracture, um, you have to also understand and remember that the scaffold is the most common carpal bone to be fractured, and it results in a vascular necrosis, right? So we understand that approximately 10% of individuals, the scaffold bone is a sole blood supply from the radial artery. So which enters through the distal portion of the bone to supply the proximal portion, right? So when a fracture occurs across the wrist of the scaffold, the proximal portion is going to undergo a vascular necrosis, right? So we can actually uh, investigate a vascular necrosis of the scaffold in the anatomical snuff box. And another in clinical importance is that anatomical snuff box is also another palpation site, arterial palpation site of the radial artery. So you can actually uh, um, feel the pulsations of the radial artery. Right. So that's all about the anatomical snuff box. Thank you so much and take care.